People often ask me about tooth decay and fissure sealants and should I have sealants done for my children, etc., etc., and why do we need sealants? Well, because the human diet is changing and we're getting more sugars and less trace minerals in our food, we're getting imperfectly developed teeth. Teeth usually are actually, a back molar tooth is actually 4 to 5 sections that come together, but it will leave a crack or a fissure between those sections, and that's called a fissure. And that fissure will attract bacteria and sugar and debris and molecules, sweet molecules of carbohydrates, fructose or sugar, will feed the bacteria into creating a cavity. And that's all it takes. And it's such a small crack that initially a toothbrush bristle cannot get in there and clean it. So ideally, I'd like to take that child back and run back to day one, get high trace mineral diet for the mother and the breastfeeding mother, and make sure that those fissures develop perfectly. If that doesn't happen, then we could clean it out, put a little sealant in. A sealant is a clear material, easy to apply, and often done without freezing, just a little bit of vibrational anesthesia. And that's our trick, is we will do fissure sealants very often, or fissure fillings. So if you want more information, email us, info@dolphindentistry.com, or phone us, 613, to learn more. Call 234 and 5758, make a smile date.